When we first got the diagnosis, they tell you, okay, you can do speech and occupational, physical, behavioral therapies. And that's, at the same time, you're struggling with the fact that you just got run over by a truck, you know, the autism truck that you didn't see coming. And you're trying to grasp what's going on. It feels like you just lost your child, like your child's gone.
I don't think anyone wants to think of especially a father, think of their son as not being perfect.
It's very difficult with a special child. It's a big struggle as parents.
It's disconcerting when you hear people, sometimes in the special ed world, saying that these children aren't going to amount to anything and you need to resign yourself as parents that this is all they'll ever be.
They're basically telling you you're basically sentenced to a life of a child with autism who's never really going to move out of your house, who's never really going to become an adult, who's never really going to have a life of her own. And to us, that was completely unacceptable. So that's how it was.
The Integrative Hyperbaric Centers were developed because we saw a need. I saw firsthand with my own daughter Grace how difficult it was to run from place to place to get therapy to therapy. And so we developed the centers so that our kids could have everything in one place.
The Integrative Hyperbaric Center is amazing in that it allows therapists such as myself to collaborate with other professionals. We can sit down with the parents and the child, the speech therapist, the physical therapist, occupational therapist, talented DAN physicians, a nutritional consultant can all sit down and look at the child as a whole instead of just seeing the little pieces that we see in our individual therapies.
For the center, these people bring the expert to me. I don't have to try to get on an airplane with my child with autism and hope that we make it through the flight. They are bringing the top people in the field, the top people, to me.
This idea of having an integrative center where parents can come and get everything done under one roof makes a lot of sense. It's very attractive. It really helps parents out a lot and helps them save time and hopefully helps the child improve a little bit faster.
It's so much easier, it makes my life so much easier because I was driving all over before. I was driving to different cities, different times of day and dragging all three of my children, and which is so nice to have one functioning place.
It's kind of like the mall of therapy. You kind of go in and you go, okay, I'm going to do this, 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 and this, and you walk out and everything's all taken care of. I just think it's phenomenal. It makes so much sense.
At the Integrative Hyperbaric Centers, we offer a variety of different therapies. We offer hyperbaric oxygen therapy. We offer ABA therapy, which is applied behavioral analysis, where a therapist will work one-to-one with a child. We offer speech therapy at the clinic, and that is individualized as well as group. We offer physical therapy, which works on the gross motor skills, but we also then have occupational therapy that works on the fine motor skills. One of the more unique therapies that we offer is suit therapy. Suit therapy is for children who need to learn how to walk, and it's basically intensive PT and OT, but it's for 4 hours a day for a 3-week program. We offer nutritional services, we have marriage counseling, social skills group, everything that a child or a parent would need, we offer in our clinics. When a patient first comes to the integrative centers, they are evaluated for the various different therapies that we have in the center. And depending on what the physician feels would benefit the patient will determine what facilities they use within our clinic.